Aloha. Hi, and welcome. Welcome again to our Facebook Live. Thank you for joining me today. And for those of you who aren't familiar with my background, I am an ND, a naturopathic doctor. And naturopathic doctors are trained as primary care physicians, so I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that with naturopathic doctors, we're trained in using diet, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. So I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. And so again, my name is Dr. Catherine Taketa-Wong, and today our topic is about dairy foods. And when it comes to our health, there may be no other class of foods that are as confusing or as complicated as dairy products. And so for some people, including some children, they can cause damaging inflammation or they can cause other problems. And for others, they can be a source of beneficial nutrition. So which is it for you and your family? That's what we're here to find out today. So please feel free to use the comment section to ask questions as the talk progresses. And at the end, I'll tell you how to arrange a no-charge phone consultation and talk with me personally about any health concerns that you may have. Okay, let's get started. So first, I'd just like to talk a little bit about what is dairy. I think there's a lot of misconceptions about exactly what dairy is. So dairy foods are foods and beverages that are produced from or that contain the milk of mammals, which is primarily cows, but it also includes goats, sheep, and camels. And one common myth is that dairy does not include eggs. I see a lot of people who are confused, and for some reason I think eggs have been associated with dairy, but just to clarify that eggs are not dairy. Eggs, of course, are from chickens and have nothing to do with milk that's produced by cows, goats, sheep, or other mammals. So a common question that I get is dairy good or bad? Or that's something that a lot of people are wondering. Is it a food that's bad? Is it a food that's good? Should I avoid it? Should I not? And the answer is that it depends. It depends on the person. So of course, people can have allergies to dairy. Technically, an allergy would be either a positive skin scratch test that you can get done by your allergist, where they put a small amount of the dairy protein on your skin, and then they look to see if your skin then gets red and has a reaction to that. But it can also be tested. A dairy allergy can be tested by blood tests, and that's looking to see whether your body is producing an antibody or a protein called IgE to that particular class of foods, which in this case would be dairy, which can include cow's milk, cheese, ice cream, cream, yogurt, those kind of things. And so a lot of people say, oh, I went to my doctor and they did a food test. They did a test to see if I have an allergy to dairy, and I don't have an allergy to dairy, so it's fine for me. Or it's, I had my child tested. My child doesn't have an allergy to dairy, and it's fine. I do like to point out to people, though, that is not the only way that people can have problems with dairy, and that if people do have allergies or sensitivities to dairy, that it can be a problem. So an allergy, as I mentioned, is one way to test. Again, that can be tested either with a blood test or with a skin scratch test with an allergist. But there are things that we call sensitivities to dairy. And if you have a sensitivity, that can include things like lactose intolerance. And it can also be something that your body is producing a different antibody called IgG to the dairy, either to lactose or to some of the other components in dairy. So lactose intolerance, what is lactose intolerance exactly? So lactose is the milk sugar. It's the sugar that's primarily present in dairy foods, And many people have difficulty being able to break down or properly digest the lactose. And that is due to a problem with producing enough of the enzyme, which is called lactase, which is needed to break down lactose, or the milk sugar. And so for people like that, there is lactose-free milk, which is basically milk where it has lactose or the milk sugar taken out of it. And so that's, not a problem. Then if you have a lactose intolerance, if they take lactose out, then it's fine. So one way to test for that, there are tests available to test if you have lactose intolerance. They're not commonly done though, because one of the best ways to test to see if you have lactose intolerance is simply to avoid dairy that contains lactose, and then see if you have any issues. Primarily people who have lactose intolerance have diarrhea or upset stomach or abdominal cramps or things like that, primarily digestive symptoms when they consume foods that have lactose in them. And so if you have issues or you suspect that you may have lactose intolerance, one of the best ways is to simply just avoid dairy that has lactose in it, and then avoid it for a period of time, see if those symptoms get better, and then reintroduce it and see if you have symptoms of abdominal cramping, diarrhea, upset stomach, those type of things. Another way to test is to have lactose-free milk, for example, and to drink that and see if that's a problem. Because if you do have lactose intolerance and you drink lactose-free milk, then you should theoretically be fine with it. But there is another way that people can be sensitive to dairy, which is their body making a different type of antibody or protein, which is called IgG. And that is something that's not commonly tested by many conventional medical doctors, but it's something that is used quite a bit in holistic medicine, because we do recognize that there are a lot of people who do have issues with dairy because their body is making an antibody called IgG. And what's going on in that scenario is that your immune system sees the dairy and it thinks that it's something bad. And so then your body starts attacking the dairy. And that can cause problems in a number of different ways. So with food sensitivities, where people are producing an IgG antibody to dairy, that can just increase inflammation in the body. And so with that can manifest in a number of different ways. I've seen some people who have more fatigue, they have headaches, joint pain. Some people may get diarrhea or other types of digestive symptoms. I see other people who have what they call brain fog. They just have difficulty thinking clearly, and they just feel like their mind is kind of slow. They can't, it's just like your mind's not quite working the same way. I see some people who have insomnia, and I see some people who have chronic infections who are getting sick a lot all the time. And when they take dairy out of their diet, then they stop getting sick all the time if they have either an allergy or a sensitivity. So those are some ways that people can have problems with dairy. And the IgG is something that can be tested by a blood test. So that is something that can be checked to see if a person has issues with a sensitivity to dairy in that way. When you have an allergy to dairy, people primarily see digestive symptoms, but they may also have issues with kind of the classic allergy hay fever type of symptoms. So they might have itchy skin, eczema, itchy watery eyes, nose, sneezing, and in severe cases they might have wheezing, or they could even have anaphylaxis, where their body starts swelling up, their lips, their throat, their tongue starts swelling up, and they may have life-threatening reactions. That's pretty rare, but that can happen. So those are some ways that people can have issues with dairy. Now, is dairy bad for everyone? I will say no, it's not bad for everyone. And not everyone has an allergy or a sensitivity to dairy. On the flip side, there are certainly positive things about dairy products. So dairy products are a really good source of calcium. That's what milk is kind of best known for. Um, and it is an easily absorbable form of calcium. So there are certain types of calcium that are easier to absorb than others. And so dairy products are a very easily absorbable form of calcium. There are, however, a number of other foods that are very high in calcium. So dark leafy greens, for example, like spinach, kale, Brussels sprouts, um, broccoli, all of those are actually really high in calcium, and people don't realize that the dark leafy greens actually have a higher density of calcium. They typically have a higher amount of calcium in the same weight or same amount of food that you might have as compared to dairy products. So there's usually more calcium in dark leafy greens, but the issue with that is that they are not as easily absorbed as in dairy products. That being said, if you are one of those people who have problems with dairy products, then you can certainly get your calcium through a number of other sources. So people think of dairy products and milk as being kind of the beverage of choice for calcium sources. That being said, there are other sources. For example, orange juice is commonly fortified with calcium, and there are alternative milks, for example, like almond milk or coconut milk or soy milk or rice milk that are often fortified with calcium. So you really do need to check the labels on those because the amount of calcium in them can vary quite a bit from brand to brand. For example, there are two common brands of coconut milk where one brand only has about 10% of the recommended daily allowance of calcium per cup, and then the other brand has about 45% of calcium per cup. So that's something where you really need to check labels. So you can certainly get calcium from other sources. There's a number of other foods that are high in calcium. For example, canned salmon, or if you pressure cook salmon or fish with bones to the point that the bones are soft and they break apart, then that's an easily absorbable form of calcium as well. You can also cook bones, fish bones or beef bones or other kinds of bones in pressure cookers. And if you cook it to the point, especially fish bones tend to be really small. And so if you cook it to the point that the bones basically break down into the bone broth or the soup, then that's actually a very good source of calcium too. You just need to make sure that it's cooked enough to the point that the bones are soft and that they won't cause problems eating them. So those are some really good sources of calcium. So definitely dairy foods are not the only source of calcium by any means. Dairy is also a really good source of protein, and it's an easily absorbable form of protein. So that is another pro for that. Of course, it's possible to get protein from other sources, from meat, for example, or from eggs, from nuts or seeds, those kind of things. So from fish. So it is possible to get protein, of course, from a number of other sources. And so another issue with, a common myth or, thought about dairy is that all dairy is the same. And that's definitely not true. So there are certain nutrients that are higher than others in dairy. And one note that I want to point out is that something that many people are not aware of is that there's something called A1 and A2 milk. So many people have not heard of this, but raise your hand or just make a comment if you haven't heard of A1 or A2 milk. So has anybody heard of that? So A1 milk and A2 milk are different types of milk essentially. So they're both milk that comes from cows. And just to back up and explain it a little bit more, there's something in milk that's called casein. So casein is the main protein that's present in milk or in dairy products. And casein makes up about 80% of the content of the proteins in milk. And there are many different types of casein, actually. So there's one type of casein that's called beta casein. And the two most common forms of beta casein are A1 and A2. So A1 beta casein is milk that comes from certain breeds of cows, mostly those that originated in Northern Europe. And so cows that produce A1 milk are breeds like Holstein, Friesian, Ayrshire, and the British Shorthorn breeds of cow make A1 milk. A2 milk is a different type of beta casein, and it's found in breeds that originated in southern France and in the Channel Islands. And this includes breeds like Guernsey, Jersey, Charolais, and Limousin. And those breeds of cows produce A2 milk. So what's the difference between A1 and A2 milk? So many people who have problems with dairy say they notice, oh, I have more digestive problems, or I have more joint pain, or whatever it is. Many people find that they have an easier time, or they don't have those problems when they consume A2 milk or products that are made from A2 milk. And you can get A2 milk products online in the health food stores. And so A2 milk, it's thought that A2 milk is a little bit easier to digest for many people. It's easier to break down. And it's also thought that it doesn't create the same types of inflammation that A1 milk does. So there are, for example, observational studies that find that there seems to be a higher risk of type 1 diabetes in children who drink A1 milk. Now, those studies are observational, meaning that they've just observed that correlation, but we don't know if that means that drinking A1 milk causes type 1 diabetes, for example. But there does seem to be a correlation with that. And it is something that is interesting, where I think that more research is needed, but it definitely does seem to be a problem for some people. And I've seen a number of patients where they have problems with A1 milk, and then when they drink A2 milk, then that seems to be a better choice for them. So there's still a lot of research, I think, that needs to be done on A1 versus A2 milk. But if you think that you have problems with A1 milk and you haven't tried A2 milk, you can certainly try that as an option and see if that causes your symptoms to improve. So that's another important point about that. I will say that in terms of dairy, a lot of people ask, well, does dairy cause more congestion? And for some people, it definitely does. Not for everyone, but clearly for some people, dairy can cause more congestion. And so that's often due to a difficulty with being able to break down either lactose, the milk sugar, or being able to break down casein, which is, of course, the milk protein, the primary protein that's in milk. So, for example, a common thing that I see in my office are children who have recurrent ear infections, where they have continual ear infections just over and over and over again, and they're kind of like on this antibiotic merry-go-round. They get an ear infection, they go into the pediatrician, they're given an antibiotic, and then they get better, and then a few weeks or a few months later, they have another ear infection, and they're just continuously on antibiotics all the time. And so one thing that I'll look for that is I will often either do a trial of taking them off of dairy. So if the child is consuming dairy products, cow milk, sheep milk, goat milk, those types of products, I will often do a trial of having the child take that out of their diet, or if the child is breastfeeding, having the mother take the dairy foods out of her diet. So having her take out milk, cheese, butter, ice cream, all those kinds of products, and see if the child improves. We can do food allergy and food sensitivity testing with that for the child to see if the child does have an issue. If the child is very young, a blood draw can be difficult, but we can certainly test the child. But I have seen a number of children that in their case, dairy does cause more congestion. And what happens is when they have chronic congestion, then you can have mucus and congestion that is sitting between the back of the ear and the back of the throat. And the back of the ear and the back of the throat are connected by something called the eustachian tube. And if there's chronic congestion built up there that doesn't drain well, then what can happen is that there can be an infection. And so if there's chronic mucus that's stuck in the eustachian tube and is not clearing, that's not draining, then these children, that if that sits and it's not draining, then bacteria can start to grow, or viruses can start to grow, and then the child gets an ear infection. And so I've seen a number of children where they have recurrent ear infections, and we take them off of dairy products, and then we see their ear infections magically resolve. And so that's one potential thing to be aware of if your child is having recurrent ear infections all the time. Another good thing, just a side note on that to be aware of, is that there are actually many types of ear infections that are actually viral and really don't need antibiotics. And so, just be aware that there are alternatives to using antibiotics, oral antibiotics for ear infections. So that's another topic, but definitely you should see a holistic practitioner to investigate other options if your child is having recurrent ear infections. There are definitely a lot of other possibilities instead of just giving them antibiotics over and over again. Do dairy products cause issues with inflammation? Does dairy create more inflammation in the body? And the answer is, again, for some people, yes, and for some people, no. But I have seen a number of patients with inflammatory bowel disease, irritable bowel syndrome, where they're having gas, bloating, abdominal pain. Also patients with autoimmune diseases where their immune system is attacking their own body, and they have fatigue or joint pain. So autoimmune diseases include things like lupus, rheumatoid arthritis, type 1 diabetes, and there are many patients that I've seen with these conditions who benefit from removing dairy from their diet. Either they figured that out on their own, or when we do testing, we do find that they have either allergies or sensitivities to dairy, and so then when they take it out of their diet, they do find that they have improvements in their symptoms and they do feel better. And that if they get dairy, or if they accidentally or intentionally consume it, then they notice that their symptoms come back. And so I will say that there are a number of people who do have issues with dairy. Again, it's not for everyone, but that is a possibility. So I would really consider that and really consider getting tested if you have an autoimmune disease, or you have digestive problems, or if you have other things like migraines, chronic fatigue, headaches, other types of symptoms. There's a number of things where, a number of conditions where dairy can be an issue. So another note on that is that I've seen a number of people where they have chronic constipation where dairy is an issue for them. And why would that be? Some people get diarrhea when they consume dairy, but other people actually get constipated. And one of the reasons for that in those cases is that there is a protein in dairy. So as I mentioned, casein is the main protein that's in dairy. And there's a portion of the casein protein called casomorphin. And casomorphin is similar to an opiate molecule. So it's called casomorphin because it's structurally similar to morphine. And there are some people who don't have the enzyme to be able to break down that particular piece of protein, which is called casomorphin. The enzyme is called DPP4. And if people don't have that enzyme, or they don't make enough of it, and there are ways to test for that as well, but if you don't have the enzyme DPP4, if you don't make enough of it, then you can have problems with being able to break down casomorphin. And if you think about what happens when people take opiates, so opiates can be things like morphine or Vicodin, what happens is that people get constipated. And so for most people, if you have the enzyme and you can break down the casomorphin, then it's no problem. But for people who don't have that enzyme, DPP4, or don't make enough of it, they can't break down the casomorphin. And then what happens is the casomorphin acts as an opiate in their system, and then it can make them constipated. So that's certainly something to be aware of as well. So other types of effects that we see with opiates is that people often, when they're on opiates, their mind kind of slows down, their speech is a little bit slower, they have issues with being able to think as clearly as normal, or their processing speed, their mental processing speed is a little bit slower. And so that's also another thing to look for. So I've seen some people who don't have the enzyme DPP4, where they only have constipation. I've seen some people, children and adults, where they have constipation as well as kind of like brain fog or mental slowing, where they feel like they can't quite think as normally or as clearly as they can. And finally, I want to talk a little bit about autism, since that is my main specialty, is with autism and developmental disorders. And I will say that dairy is probably one of the most common problematic foods for children with autism. Many of the children with autism, when I test them, they either have allergies or sensitivities to dairy, or they don't make the enzyme DPP4. And so they have problems with being able to digest or break down dairy, or their body has problems with dairy. There are other people, other children with autism, where they have a condition that's called folate receptor antibodies. And that is something that I have talked about. We have another Facebook video here where we talk about folate receptor antibodies and what it is and everything. But just to summarize that really quickly, folate receptor antibodies it's an autoimmune condition, and it's basically that they have something, a protein, that is blocking folate from getting into their brain. And so these antibodies block folate, which is an important B vitamin, from getting into the brain, and then we don't have normal brain development. But one of the other things that we've seen in the research is that dairy foods cause the body to make more of these folate receptor antibodies. And so the problem with that is it causes even more problems with that B vitamin folate to be able to get into the brain. And it also causes problems with brain inflammation. It's not a life-threatening type of brain inflammation, but it is inflammation that affects language, behavior, social skills, cognitive understanding, and can be a risk factor for seizures as well. So basically, children who have this condition called folate receptor antibodies, those children should definitely avoid all dairy products. So that includes all products that are made from cow, sheep, goat, and camel milk. So all the cheeses, ice cream, cream, even butter. So those are issues with the children who have the folate receptor antibodies. And so there are many, many children with autism where I've seen when we take dairy foods out of their diet that they significantly improve. Their diarrhea or their constipation gets better, or their acid reflux, or their constant aggressive behavior because their tummy hurts gets better, or their language gets better, their cognitive function gets better. So that's another thing in terms of that to be aware of. So that's another thing, that if you have a child with autism, definitely call our office to schedule a free 15-minute phone consult to talk with us, because there's many potential ways that children with autism or other developmental delays. I have seen children with Down syndrome who also have issues with dairy, and so that's really something to look at. So just to let you know, I'll be wrapping up soon, and I'll be telling you about how to arrange a no-charge phone consultation to talk with me personally about any health concerns that you may have. And then a few more notes that I wanted to share about dairy. So if you think about where dairy comes from, right? Dairy comes from, of course, cows that produce milk naturally, and it's supposed to be only produced when they're pregnant, right? I mean, when humans produce milk, it's only after they have a child, and then they give birth, and then you produce milk for a while for your baby, and then after the baby is weaned, then you stop producing milk. So it should be the same way for cows. Cows should make milk theoretically only after they've given birth. Um, and then after that, they really shouldn't be making milk anymore. But what happens is that in industrial farming, many cows are given artificial hormones to trick their bodies into thinking that they're pregnant all the time. So that way they produce milk all the time. And there are also many other, there are many other hormones and other things that are fed to cows conventionally. So, for example, there growth hormone that can be given to the cow to produce more milk, to, in that, they will often give a lot of different things to try to increase the milk production. And another thing is that they often will give antibiotics to cows. And so you have to remember that if cows are fed antibiotics and hormones, they'll give antibiotics to often try to prevent infections or to treat infections. But many antibiotics also cause the cows to produce more milk. So sometimes it's not given from a health perspective, but often it's given from the perspective of trying to increase milk production. And so if you just have to remember that if cows are fed antibiotics and hormones, then those antibiotics and hormones are going to go into their milk, and we're drinking that. So if you are drinking dairy, I really, really strongly encourage people to drink organic dairy and to consume organic dairy products. So organic in the context of dairy means that they are not feeding the cows antibiotics and hormones, and that they theoretically should be rotating the cows so that their cows aren't continuously producing milk. And if you think about, like for a woman, if she was pregnant and you just imagine lactating forever and ever and ever for the rest of your life, that's not healthy for that particular tissue, because if the glands there are always producing milk constantly, then what happens is that that tissue could eventually become inflamed because it's not a natural state to be producing milk all the time. And personally, I think that one of the reasons that dairy is inflammatory for many people is that the industrial scale of milk production that we have in our country, here in America especially, with the feeding of antibiotics and hormones, and having cows who are basically lactating for their whole lives, that gland can become inflamed. And some of those inflammatory, they're called cytokines or chemical messages, those can go into the milk and they can create more inflammation within our bodies as well. So that's why I really encourage people to, as much as possible, get, again, organic dairy products, so organic milk, cheese, cream, ice cream, all those different kind of things, because that can be a factor. And sometimes people have problems with non-organic dairy because of all the additives in there, but then they're fine with organic dairy. Another note on that is that many of the antibiotics and hormones, things like growth hormone, are fat soluble. And so they concentrate in the fat. And if you think about butter, butter is basically milk that's been concentrated. They take the fat out and then they concentrate it into this little stick of fat. And if the antibiotics and hormones are fat soluble, then in butter, you're going to get, if you have cows that are fed antibiotics and hormones, in the butter, you're going to get a very high concentration of antibiotics and hormones in your butter if it's not organic. So I really do encourage people to get organic butter, especially because if you don't have organic butter, you're going to have a lot of, you're going to be consuming a high concentration of antibiotics and hormones, unfortunately. So there are a number of different organic butters. There's also grass-fed butters, Kerrygold, Irish-fed, cows raised in Ireland, where the cows are grass-fed and it's organic, is one of those sources that I usually recommend for people. But there's other sources of organic butter, other brands that are very helpful too. So again, I thank you for joining us. So just wrapping up our talk about dairy foods, I want to thank you for being here, and I appreciate the opportunity to let you know a little bit about the often confusing world of dairy products. If you'd like to arrange a personal no-charge phone consultation, it's really easy. Just call our office at 808-783-0361. Again, 808-783-0361. And you'll also find the contact information on our Facebook page. And mahalo, and we will see you in 2 weeks. Aloha.